The product information in this video is intended only for U.S. residents. This video features an actual patient to show an individual's experience with FOTIVDA tivozanib. The patient was paid for her time and expenses in sharing her story. The video describes her experience with FOTIVDA, but results do vary. The information in this video is not intended as medical advice. Please talk to your doctor if you have any questions about your condition or to see if FOTIVDA may be right for you.
I've always been a resilient, determined person. I raised my son with my husband and worked full-time as a bartender in a real hard-working blue-collar community. When I was in my late 40s, I went to the doctor with what I thought was a hip injury. I had an x-ray done, and when they called with the results, they said I had a mass that they wanted to do a biopsy on because it looked cancerous, and I was floored. I'd never in a million years thought cancer. I had a biopsy done, and when my oncologist gave me my results, he diagnosed me with advanced renal cell carcinoma, also known as RCC or kidney cancer. I had kidney cancer in my left kidney that had metastasized into my right hip and pelvis. My oncologist told me that there is no cure for kidney cancer, but there are several things that we could do to combat it. I had surgery to remove my kidney and the tumors around my hip. After my surgery, I started my treatments to fight the cancer. I started going in for regular scans, and everything looked okay. I felt like my normal, lively, positive self again. Then, after some time, I felt a pain in my hip and eventually couldn't even walk. After another scan, my doctor found that my RCC had returned. When I found out that the cancer had returned, I was shocked because I thought I'd been cancer-free. I tried a couple oral and infusion treatments. I felt hopeful that these treatment options would control my RCC. Eventually, I developed a tumor that couldn't be removed. My oncologist said not to give up hope because there were always more tools in the toolkit. His positive attitude made it real easy for me to form a very trusting relationship with him. He won't let me give up because he never gives up. That's when he told me about FOTIVDA, a treatment option for people with recurring kidney cancer who have been treated with 2 or more prior medicines. He told me about the most common side effects of FOTIVDA, which include nausea, diarrhea, fatigue, and hoarseness. I knew that I wasn't ready to quit my fight against cancer, so I decided to give it a try. Once I started FOTIVDA, the scan showed that my disease was responding to treatment. Seeing that my cancer was being controlled felt like a victory to me. I continued to take FOTIVDA to treat my advanced RCC. My doctor and I have been very happy with my results on FOTIVDA. I take 1 pill a day for 21 days, followed by 7 days without medication. I do experience some side effects such as mouth sores, hand and foot sores, fatigue, and high blood pressure. I work with my healthcare team to help manage these side effects. I go to regular visits to my oncologist and receive frequent scans to make sure my cancer is still under control. Even with all the extra routine and medications I have to take, it's still worth it. It feels like we finally found the right tool to fight my kidney cancer. Since starting FOTIVDA, I am looking forward to life and sharing experiences with my family and friends. I'm happy to be working in my garden and getting out there and having fun. What's most important is that I never gave up.
Indications and important safety information. FOTIVDA tivozanib is a prescription medicine used to treat adults with advanced kidney cancer, advanced renal cell carcinoma, or RCC, that has been treated with 2 or more prior medicines and has come back or did not respond to treatment. It is not known if FOTIVDA is safe and effective in children. Possible serious side effects can occur with FOTIVDA. Call or see your healthcare provider right away if you develop high blood pressure, hypertension. High blood pressure may be severe, including a sudden severe increase in your blood pressure, hypertensive crisis, that can lead to death. Your healthcare provider should check your blood pressure after 2 weeks and at least monthly, and may prescribe medicine to treat high blood pressure. You should check your blood pressure regularly and tell your healthcare provider if you have increased blood pressure or experience confusion, headaches, dizziness, chest pain, or shortness of breath. Heart failure. Heart failure may be serious and sometimes lead to death. Your healthcare provider should check for symptoms of heart failure regularly, such as shortness of breath or swelling of your ankles. Heart attack and blood clots in your veins or arteries. Blood clots may be serious and sometimes lead to death. Tell your healthcare provider or get emergency medical help right away if you have new chest pain or pressure, numbness or weakness on one side of your body, pain in your arms, back, neck, or jaw, trouble talking, shortness of breath, sudden severe headache, vision changes, swelling in the arms or legs. Bleeding problems. Bleeding may be serious and sometimes lead to death. Report or get medical help right away if you have unusual bleeding from the gums, red or black stools, looks like tar, menstrual bleeding or vaginal bleeding that is heavier than normal, bruises that happen without a known cause or get larger, headaches, feeling dizzy or weak, bleeding that is severe or you cannot control, coughing up blood or blood clots, pink or brown urine, vomiting blood or your vomit looks like coffee grounds, unexpected pain, swelling, or joint pain. Protein in your urine. Your healthcare provider should check your urine for protein before and during treatment. Thyroid gland problems. Your healthcare provider should do blood tests to check your thyroid gland function before and during your treatment, and may prescribe medicine if you develop thyroid gland problems. Risk of wound healing problems. Wounds may not heal properly during treatment. Tell your healthcare provider if you plan to have surgery before starting or during treatment, including dental surgery. You should stop taking FOTIVDA at least 24 days before planned surgery. Your healthcare provider should tell you when you may start taking FOTIVDA again after surgery. Reversible posterior leukoencephalopathy syndrome, RPLS. RPLS is a condition that can happen. Tell your healthcare provider right away if you have headaches, seizures, confusion, blindness, or changes in vision, or difficulty thinking. Allergic reactions to tartrazine, FD&C yellow number 5. FOTIVDA contains a dye called FD&C yellow number 5, tartrazine, that may cause allergic-type reactions, including bronchial asthma, in certain people. This occurs most often in people who are also allergic to aspirin. The most common side effects of FOTIVDA include tiredness, diarrhea, decreased appetite, nausea, hoarseness, low levels of thyroid hormones, cough, mouth sores, decreased blood levels of salt, sodium, and phosphate, increased levels of lipase in the blood. Other side effects include vomiting and weakness or lack of energy. FOTIVDA may cause fertility problems in males and females, which may affect your ability to have a child. Your healthcare provider may change your dose, temporarily stop, or permanently stop treatment with FOTIVDA if you have certain side effects. These are not all of the possible side effects of FOTIVDA. Before taking FOTIVDA, tell your healthcare provider about all your medical conditions, including if you have high blood pressure, have a history of heart failure, have a history of blood clots in your veins or arteries, types of blood vessels, including stroke, heart attack, or change in vision, have bleeding problems, have thyroid problems, have liver problems, have an unhealed wound, plan to have surgery or have had recent surgery, including dental surgery. You should stop taking FOTIVDA at least 24 days before planned surgery. Are allergic to FD&C yellow number 5, tartrazine, or aspirin. Are pregnant or plan to become pregnant. FOTIVDA can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment. Use effective birth control, contraception, during treatment, and for 1 month after your last dose. Talk to your healthcare provider about birth control methods that may be right for you. Tell your healthcare provider right away if you become pregnant or think you might be pregnant. Tell your healthcare provider about all the medicine you take and any new medicine, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking FOTIVDA with certain other medicines may affect how FOTIVDA works. To report suspected adverse reactions, contact Aveo Pharmaceuticals, Inc. at 1-833-FOTIVDA, 1-833-368-4832, or FDA at 1-800-FDA-1088. or www.fda.gov/medwatch. Please see the patient information in the full prescribing information for FOTIVDA tivozanib.